We're going to let you start with a 2-minute opening statement. Then I'm going to get you on vaping.
Okay.
Anyway, you have 2 minutes to start.
All right. Good afternoon. I'm Senator JaNice Van Ness, and I have the pleasure of serving all of you in District 43, which includes Rockdale, Newton, and the Lithonia portion of the PAC. This 2016 legislative session has been a very exciting opportunity for the district and for our visibility under the Gold Dome. There's a lot of issues I'm very passionate about, and for that reason I'd like to shorten my opening statement so we can get right to the questions.
Okay, thank you very much. All right, you know I'm a vapor. You know I believe it's the greatest thing to happen to public health in our lifetimes. The FDA recently published their regulations for vaping to the Federal Register, and without going into the details, they're disastrous to the industry and public health. You're certain to see anti-vaping bills introduced again next session, capitalizing on these ridiculous regulations. Can I count on you to take a scientific and learned approach to their regulation and follow the advice of the Royal College of Physicians, who last week recommended that their use be promoted among all smokers as a harm reduction method that will save lives and billions in medical spending costs?
So I would evaluate all the information, but I'm fortunate that you do provide a lot of information to me. But I am on the Health and Human Services Committee for the Senate, and that has been a committee that really investigates and learns more about a lot of the issues that come before us. What I have found during my time is that a lot of the colleagues that I work with have so many committees that they don't necessarily have time to really research each of the issues. I've taken a lot of personal time to make sure that I'm very knowledgeable about the issues before me, and that I not only take what's given to me as factual, but also do additional research as well. And so yes, I'm aware of vaping. My mother has COPD because of smoking, so of course it's something I'm passionate about, is finding alternatives and for healthy citizens in our community. But yes, I would look at all information, and I absolutely believe in supporting the private market, and that it's driven a lot of times by consumer demand. So.
Thank you, Senator.
Ms. Van Ness, could you define Common Core for us and let us know, explain why you are against it?
Okay. So the philosophy of Common Core in an ideal world would really be where nationally, if you move from Georgia to California, that your third grader would be on par in both states. So many legislators have talked about the importance of having an economic development driver, such as increasing the levels of education across our nation. As many of you know, Georgia ranks about 48th in the nation, give or take the statistics that you look at, and we know that it is important for us to increase the workplace education programs. Common Core has been something that is almost experimental in many regards for children sitting in our public schools. I am a supporter of tried and true educational methods, and Common Core lacks a lot of the statistical data to really show effective gains in education. So not only do I disagree with a lot of the Common Core principles as they've been administered, but at my own school, which I have been in education for 25 years, we adopt traditional, tried and true measures.
Thank you very much.
Welcome, Ms. Van Ness.
Thank you.
I do know that your passion is in education, and it has been ever since I've known you. My question is going to revolve around that education,
Okay.
as you might imagine. I'm not going to give you the question that we gave the other state representatives. You and I have had many conversations, and I think many of the people in this room have also had that conversation with you. My question to you is more about how is education funding going to change in coming years? I'd also like to hear your view on the charter school initiatives, and how is that going to change the education system?
Okay.
Thank you.
So first with the funding formulas, so there are 56 senators in the state of Georgia, and I am the only one that's an educator. So we know in the state of Georgia that education is the #1 opportunity for people to gain economic prosperity for their families. With that being said, there's a lot of different issues that come before us that are school related, that I have firsthand knowledge and access to individuals who have experience with certain legislative measures. When it comes to funding, I am really excited to say that in 2016 we made some of the biggest educational leaps from a legislative standpoint as well as a budgetary standpoint. So we are very fortunate in Georgia that we did have great revenue for this year, and we are ahead of schedule financially. And so the $23.08 billion budget did include a 3% raise for all school teachers as well as bus drivers and cafeteria workers. So that was certainly a great measure, but we were also able to restore austerity cuts, not fully, but partially. And so in 2017, that is something I will definitely work towards, is getting more funding for our schools, but also looking at a funding formula and looking at measures to tie it to more poverty-stricken areas where we knew additional supports need to be had.
Thank you.
Thank you.
Could you tell us what your position is on legalization of marijuana, medical and recreational, or both? And what challenges does Georgia face with your stance on this?
Okay. So I am a strong supporter of the expansion of medical cannabis, cannabis oil being used with the list of approved illnesses in the state of Georgia. And so I fought very hard for an expansion of that list. The new expansion list that I expect in 2017 that we will almost with certainty be able to achieve would be to expand it to include autism for children or adults, as well as terminal illness and cancer. So tell me the rest of that question, I'm sorry. Besides that.
How would it affect Georgia?
Okay.
Georgia. And PTSD also is on that?
It is. It was on the proposed list, PTSD, and I know a lot of our veterans fought very hard for that measure to be included. There's a lot of resistance to that in opening Pandora's box, and then how many people are really going to be on the list for cannabis oil. Right now what we know is there's approximately 400 to 500 people who have the doctor's certification card. The challenge for people that are using cannabis oil is that there's not a dispensary in the state of Georgia. Or a mechanism for them to legally purchase it. So you'll find many families that actually travel out of state to other communities and purchase the cannabis oil and then return. My greatest concern with that, as I sat on the Health and Human Services Committee, was the fact that when the cannabis oil is purchased, depending on where it comes from, it's not tested, so we don't know the safety of it, and it's almost buyer's risk when you have it. But I will say that on the internet you can actually purchase 1% or less because it's considered hemp. I do not support the cultivation of marijuana at this time as a whole in the state of Georgia, because in the different law enforcement personnel that we've spoken with, there's great concerns for how they would actually regulate it and ensure public safety because of just the different mechanisms and the gateway drug that it is referred to.
If these people go to Colorado to get the cannabis oil, is it legal for them to bring it back into Georgia?
Technically, no.
That's what I thought.
The CBT, if it's legal here, wouldn't it be illegal?
CBT, the cannabis oil?
Yeah, that's legal here
but
if
when
they
you
have
cross-
one of those elements.
But when you have interstate commerce laws in place, it's illegal
Oh.
because of the federal schedule. So if they, if they reduce the level of scheduled drugs for marijuana, then that would eliminate the issue. So the federal level is really who needs to handle that issue. So.
Gotcha.
Thank you so much.
I have one quick one before closing statement.
Sure.
Do you want to see leadership call for a vote to overturn Governor Deal's veto of campus carry?
We've already discussed it, and they won't be doing that. So, but I do predict that in 2017 it'll be back on the table again.
Will you vote for it? Will you vote for it?
Will you vote for campus carry?
Well, I think what we're going to do is go back and work with the Board of Regents to look and make sure that we have as strong a policy as possible. We talk about oftentimes the issue of Georgia State, Georgia Tech, where there's not defined borders for a campus. I think when that that conversation is brought into reality for a lot of people, and the fact that if you're 21, a lot of those students at that age are actually going to technical schools and at night and things like that, the element of concern is certainly understood a lot better than campus carry on Berry campus or something like that, a more traditional defined Borders campus. I did support it last time. I will say that we were not able to hear any of the debates or concerns or anything from the Board of Regents, which was certainly a concern. They actually did not lobby at all. But I would like to see some sort of requirement for asking to see a permit on a college campus.
Absolutely. Thank you so much. You have 2 minutes for closing statements.
May I continue to have questions instead? Do you have any? No?
I've got one.
Okay. Go ahead.
You know me?
Yes? Go ahead.
During this last legislative session, what do you hail as your biggest accomplishment and your biggest challenge during this season?
So I would say one of the biggest accomplishments was the rape kit bill, because nobody really expected it to go through, but that's something that I fought very hard for, and that involved the rape kits is an example that had been sitting on the shelf for the last 20 years down at Grady. So when a woman was raped, they would come in to the emergency room, they would have the process started, and then the kits would just sit there and never process through law enforcement. So this actually provides for the structure so that when women are raped, that they actually have communications with law enforcement, and the local law enforcement agency will now have the structure to provide that they will pick it up and deliver it to the GBI. So I think that's a great gain, not just for the public safety, but also for women's health issues.
That's
And
what,
your biggest challenge?
The campus carry. That was a very, very hard decision for me, and although I'm a strong supporter of Second Amendment rights, I think knowing that my 2 children and other people that I know their children are on college campuses, I think, even though we excluded dormitories, sports events, and things like that, the challenge becomes when you're on a campus and you're going to visit a friend, where is your gun being stored? In the car. Mm-hmm. So, but there's just a lot of fine tuning that I think could be had and make it a much stronger bill. There was a lot of opposition, among many people across the state. So even Second Amendment rights supporters had concerns about this legislation. So,
a follow-up on the rape kit is the law enforcement's going to get them back to the GBI. That's been the stall all along, there's so many hundreds of them, the GBI doesn't have the personnel to process them quickly enough. So are they still going to be stalled?
well, they actually have a company in place. Unfortunately, it's a company that's outside of the state of Georgia that will now process these, because there is a federal grant that helps fund that.
Yeah, good. Thank you.
Can we ask a question?
I was going to say, would you like to open it up to the room?
Yeah, I think that's a good use.
I need to be out of here by 6, okay?
We're only at 3:40, so, yes.
And I mean, I've got several based on some of the things you said, but because there are other people in here, I'll limit it to one. So I'll go back to the marijuana issue. First, how much research have you actually done on marijuana and the benefits? And 2, wasn't it just more of a show vote to approve the use of it, because it was actually just theater, because you didn't make it legal for people to be able to cultivate it here in this state and bring it back? What was the point in that exercise if you weren't going to allow people to actually use it? And this is something that Georgians want overwhelmingly. Overwhelmingly. Even with campus carry, you said there's a lot of opposition. No, it's not that much opposition. It's the governor decided to veto.
So back to your question, it's about, okay. So just to clarify, I would have to tell you, you would need to ask the parent of a child who has seizures the importance of the legislation, and they would tell you it's significant. So I was not there in 2015 when the legislative theater started for that discussion. What I can tell you in 2016 is that I worked with Representative Alan Peake, Many people in the special needs field to advocate for the expansion of the list and work to try and find a more positive outcome. So while cultivation is not going to be legal, I don't even think that's going to be on the table for 2017. I will say that the cannabis oil has been very effective for many families across Georgia, and I think the list will only continue to expand. I would like to see that the doctors are allowed to be doctors and not us decide which of the ailments get to be decided as a use. So in the testimony that we heard and in the research that I did, it's been a very effective mechanism. I would like to see that in the state of Georgia we deal with the fact of not being able to have it sold. I would love to see one of our medical colleges actually become a dispensary in the state of Georgia so that they would have access within the state of Georgia to the oils.
Thank you. Senator.
As an epileptic for 54 years, I take a lot of medications from Big Pharma. They depend on me. They make a lot of money off me. The toxins from those medications are destroying my liver and my pancreas. So as Mr. Grayson just said, what Governor Deal did, that was just a big show, dog and pony show, because those of us that suffer, and the children that you mentioned, and I know so many of them, it is federally illegal for us to bring it across state line. So as a senator, are you not going to stand up and represent people like me and those children that need CBD, not CBT, CBD oil? We have to cultivate it in the state of Georgia at some point or another. Regulations, of course, we don't need it in the wrong hands. But I don't think it's appropriate to deny Georgians the right, and it's a state issue. In my humble opinion, it is a state issue. And as a state senate, I would like to think that you would fight for my rights and those children.
Well, let me just close by saying that I do fight for the rights of not only those in District 43, but across the state. However, if there's no voice down at the Capitol, no voice or contact with your legislators, it does make it more challenging to understand what the true need is. But I have worked vigorously with many of the residents, not just here, but across the state, to fight for a better opportunity for their families. So, thank you.
Is there a possibility that a medical college could begin to grow experimentally in this?
And that's what I've suggested, is that we allow someone in the state to become a dispensary, because not only would they be the dispensary, they'd also be the research component that I think is very important.
Well, thank you. Apparently this is a big deal in Georgia and I had no idea.
It's
Like a town hall.
it's a
Moving on
huge
to-
deal.
That's it. Do you want 2 minutes to close, or
I just
did
wanted
you?
30 seconds, if I could, to say, this has been a great opportunity for our district to really be represented down under the Gold Dome. I hope that I can continue to work and expand my communication tools, both through social media and through my newsletter, if you'd like to sign up for that, because that is how I push information out. We're working on developing a tool that will allow me to actually get more instant feedback when legislation comes up. It could be everything from campus carry to medical cannabis oil questions that I send out as a survey, and people were able to send it back to me, because really that feedback is a critical piece. And then lastly, I'd just like to say we are continuing to work through the community, and after the primary election we'll be doing a lot of canvassing. If you'd like to help or in any way advocate for different issues, please get in touch with me. I do have signs outside, so feel free to take one and put them in the community.
Thank you so